When your baby was born, your little one was attached to you from the umbilical cord. And once that umbilical cord finally comes off, the muscles right around that belly button are still very weak. I mean, after all, we had a hole right in the belly over there where that umbilical cord went. And those muscles take a while to tighten up. They can take up to 4 or 5 years to really tighten up thoroughly. And in some cases, usually 1 out of every 5 babies who are born, you will get a little bit of bulging in that area. That bulging can be the size of a marble, it can be the size of a golf ball. But that bulging is really what we call an umbilical hernia. It's everything inside the baby trying to push out that little bit of an opening. This tends to be harmless and tends to resolve on its own. Most resolve within 18 months. Once in a while, they will persist a bit longer. Usually by 4 years of age, almost all of them resolve on their own. Years and years ago, doctors used to see an umbilical hernia and they would instantly want to sew it up and correct it. Then we found that, boy, we really didn't need to do it. That was going to resolve on its own. There really was no need to put babies through endless surgeries. Doctors have found other things to operate on instead. So you have this bulging right at the belly button. What are you supposed to do about it? Well, most of the time, as we said, nothing. But once in a while, they do need to be attended to medically. When is this? Well, one, if they persist for the longest time, usually 3, 4, 5 years, and they're not healing up on their own, it's very likely that surgery would be recommended to close it. Sometimes you'll get a really tight band around the area and it's just not going to close up on its own. And 2, if the area becomes infected. And that becomes very obvious because the skin isn't nice, shiny newborn skin. The area becomes very pink, very tender. You don't want to touch it because your baby's going to scream. And in very serious cases, your baby will have a fever. These are definitely medical emergencies. This is something that needs to be attended to right away. Now, for healthy babies who have an umbilical hernia, some parents want to put a swaddling band on their baby. Is this necessary? Not at all. This umbilical hernia is going to resolve on its own no matter what you do. Is it harmful? Not at all. You can certainly use a swaddling band if you want. They come in wonderful colors, they come in wonderful patterns, they look cute sometimes, but they really don't serve any other function except for a fashion accessory. Let's talk next video about something that is not necessary and potentially can be harmful, and that's called a Lotus Birth. Your shares and likes are the best, and I wonder if I had an umbilical hernia as a child.